Good morning, friends. We hope you are doing well and safe. I'm Dr. Sushant Joshi, practicing at Joshi ENT Clinic, Vatago and Snoring Center at Udaipur. Today, we are going to discuss about allergic rhinitis and its management, which will help you understand the disease better. When we see allergic rhinitis overview, exactly what it is, then the word rhinitis refers to the inflammation of the nasal passage or nasal mucosa. This inflammation can cause a variety of annoying symptoms, including sneezing, itching, nasal congestion, running nose or rhinorrhea, and postnasal drip. What is postnasal drip? It is a sensation that mucus is draining from the sinuses down to the back of the throat. Now, a few episodes of rhinitis are usually caused by respiratory tract infections, so viral influenza virus or something, the most important causes are viruses. And as common cold, what we call. Allergic rhinitis is caused by allergens. This is not any bacterial or viral infection. It is not inflammation caused by a bacteria or virus, but by allergies to the things in the air around you. Chronic or long-term rhinitis is usually caused by allergies, but it can also result from overuse of certain drugs like some medical conditions and other known factors. For many people, allergic rhinitis is a lifelong condition that waxes and wanes over time. Fortunately, symptoms which can usually be controlled with a combination of environmental measures, medications, and immunotherapy. Now, who gets allergic rhinitis? Who are prone to get allergic rhinitis? Allergic rhinitis affects approximately 20% of people of all ages. The risk of developing allergic rhinitis is much higher in people with asthma or eczema or type 1 hypersensitivity, and in people who have family history of asthma or allergic rhinitis. Allergic rhinitis can begin at any age. Most people first develop symptoms in the childhood or young adulthood. The symptoms are often most severe in children and in people in their 30s or 40s. However, the severity of symptoms tends to vary throughout the personal life. Sometimes it becomes very severe, sometimes become very milder, sometimes patient can have a few years or few months of completely symptom-free life. Some people go through periods during which they have no symptoms at all. Now, what are the causes of allergic rhinitis? Allergic rhinitis is caused by a nasal reaction to small airborne particles called allergens. Allergens are substances that provoke an allergic reaction. In some people, these particles also cause reactions in the lungs, which leads to asthma, and eyes, which leads to allergic conjunctivitis. The allergic reaction results from activation of two types of inflammatory cells in the body, called mast cells and basophils. These cells produce natural chemicals such as histamine, which causes symptoms such as nasal congestion, itching, sneezing, and a running nose. Actually, these are inflammatory reactants which leads after allergic reaction happens. They tends to cause all these varied symptoms. Seasonal versus perennial allergic rhinitis. There are two types of allergic rhinitis. One is seasonal and one is perennial. Allergic rhinitis can be seasonal, which occurs during the specific season or specific time of the year, or perennial, which occurs all the year round. The allergens that most commonly causes seasonal allergic rhinitis includes pollen grains from trees, grasses, and weeds. And the allergens that most commonly causes perennial allergic rhinitis are dust mites, cockroaches, animal dander, fungi, or molds. Perennial allergic rhinitis tends to be more difficult to treat, obviously because it is present all the year round, and the allergens sometimes go unnoticed, and it is very difficult to find out what exactly allergens are leading to all those things. Now, what makes the symptoms worse? Outdoor allergies, the best way to prevent the allergic rhinitis is to avoid the things to which you are allergic, because allergic rhinitis is caused by outdoor allergies that can be hard to do. If you have outdoor allergics, then there are some things you can do to help. Keep your doors and windows shut during the pollen season. Use an air conditioner to cool your home instead of coolers or fans that brings in outside air. Consider pollen counts when planning outdoor activities. It may help to limit your outdoor activities when pollen and molds counts are at their highest. Pollens and molds count can vary throughout the day, and peak times are grass. The pollens from the grass are usually high at afternoon or early evening, ragweed early midday, and molds sometimes it peaks during warm, dry, windy afternoons, and other types occurs at high levels during the periods of dampens and rains. Dust mites, if you are allergic to dust mites and lives in a humid area. Cover your mattress. Now, if you're allergic to the dust mites and you're living in a humid area, then cover your mattresses and box springs in a zippered, dust-proof encasing. Wash your pillow sheets and blankets weekly in a hot water. Dust mites will survive in lukewarm water. Animal danders Urine and saliva from feathered or furry animals are major year-round allergens producing by common pets such as cats, dogs, birds, hamsters, gerbils, and horses. If you're allergic to animals, then do not keep any furry or feathered pets in your home. If you must keep the pet, try to keep it outdoor. If the pet comes indoors, make sure it stays out of your bedroom at least all the time. After exposure to the pet, wash your hands and change your clothes. Otherwise, it will lead to high allergic reactions. Now, many substances can irritate the nose, throat, or airways. Common irritants include smoke, such as tobacco, smoke, and wood burning stoves, or kerosene stoves and fireplaces, aerosol sprays, strong odors, dust, and air pollution. Reducing or exposure to irritants can be very helpful. Now, it is very important that no one smokes in the home or a car. Avoid aerosol spray, perfumes, strong cleaning products, and other odor sources in the home. Now, what are the common signs and symptoms of allergic rhinitis? The symptoms of allergic rhinitis vary from person to person. Although the term rhinitis refers only to the nasal symptoms, many people also have symptoms that affect the eyes, throat, and ears. Sleep may be disturbed as well. Symptoms may include the following. The most common symptoms leading, presented by allergic rhinitis are depending on the organ. The nose. Nose is the most common affected part, which leads to watery nasal discharge, rhinorrhea. Blocked nasal passages, congestion, sneezing, bouts of sneezing, sometimes may be in numbers of 20s or 30s at one go, nasal itching, post-nasal drip, loss of taste, facial pressure or pain. Eyes, itchy red eyes, a feeling of grittiness in the eyes, swelling and dark discoloration of the skin below the eyes, which is called allergic shiners. Throat and ears, sore throat, hoarse voice, congestion of popping of the ears, itching of the throats and ears, and sleep leading to mouth breathing, frequent awakening, snoring, daytime fatigue, trouble doing normal activities. With the perennial allergic rhinitis, the predominant symptoms include postnasal drip, persistent nasal congestion, and trouble sleeping. The diagnosis of allergic rhinitis: your doctor can diagnose allergic rhinitis by doing a physical examination, reviewing your symptoms. Medical test can confirm the diagnosis and identify the offending allergens. Now, how we identify the allergens and other triggers? It is often possible to identify the allergens and other triggers that provoke the allergic rhinitis by recalling where you were and what you were doing before your symptoms started. For example, spending time outside or around animals, noting the time of year during which you have noticed symptoms, looking closely at the home, work, and school environment for potential allergen identification. Your doctor may suggest skin prick testing if your symptoms are not well controlled with medications, or if it's not clear what's causing your symptoms. This involves an allergens, putting tiny amounts of different allergens on your skin and observing which causes a reaction. Blood tests are also available, although these are not needed in all situations. This is all about the routine allergic rhinitis, how we diagnose it and how we kind of prevent it. So what we conclude from this presentation, that prevention is most important part of the management of allergic rhinitis. You have to prevent the allergens, which will give you the long-term benefit overall. Thank you so much.